Hello dear patients and our followers. Today we would like to share with you the procedure on how to do the wash after the hair transplantation surgery in female patients. In general, the main aspect of the wash of the hair after the surgery is almost identical in men, but of course there are some minor differences. First of all, the first thing we do when we want to do the wash, we need to remove the bandage of the donor area. A very gentle removing of it from the back is perfectly enough. Okay, when removing the bandage, one of the biggest difference we have in the female patients, most of the time we use the window technique. So side of the hair on the right, left, lower part of the hair and upper side stays, and we open up a window. The size depends on the number of the grafts we need to get. And because when we put the bandage, the bands can get sticked to the hair, you have to remove them slightly carefully, and you can ask for the assistance from your family members. After removing the bandage and paying attention so you won't grab your hair from here, the second thing we look for, because we do it with the longer hair and the patient have its hairstyle the way that the pre-existing hair will not get stuck to the newly transplanted ones and one will not overlap with them. So we keep it the same and the rest of the wash is almost the same. The first thing we do is we apply the lotion that is in your amenity kit bag on the transplanted area. This lotion is needed to make the transplanted area scabs softer, and so the scabs will not build up over the time. For the transplanted area, what do? You apply the lotion and gently tap it over this one. No circular motions, you just tap it on a vertical plane this way. The pressure should not be high, it should not be low, it should be the medium lower pressure, just like this. Because if you make the tapping too soft, the scabs will build up and there will be a thick core of these scabs all the time, and removing them will be much harder. So you apply the lotion, it will soften the scabs, and the same lotion for the transplanted area should wait for around 3 up to 5 minutes. But for the donor area, application is different. We grab the same lotion, it's foamy, apply it to the donor area, but for the donor area, we can do circular motions and gentle rubbing. You clean up the dead tissues and scabs from the back of the head, so it will also help with the healing. The main points we have to pay attention for female patients: number one, transplanted area, because there are still pre-existing hair. The pre-existing hair can get stuck and get attached to the transplanted side, and when trying to pull it, you can easily fish out the graft. So be very careful, make this area soft and very gently separated. If you see that's attached, don't try to pull it with the force. Let it go. With a couple of washes after the wash, it will get smoother and get off itself. That's number one. Number two, because during the surgery or during the wash, small blood clots can be left between the hair, do the wash appropriately. So you can do the wash for the non-transplant area the way you used to do before the surgery. The only thing you pay attention to, no force or pressure with the rubbing to this area, and the water with the high pressure should not hit this area. But for the rest of the head, perfectly fine with us. As you saw earlier, when we do the surgery for the female patients, we make the braids for the hair so it stays combined at the back and it will not overlap with the transplanted side. It will also help us to take care of hair after the surgery and during the wash much easier. So the braids are opened and we separate it with the small comb. Before doing the wash, the same rule that was for hair wash after the surgery for men, the same applies here. Water should not be cold, it should not be hot, it should be warm water with the low pressure, no high pressure or no direct water stream over the transplanted area. After waiting for 3 to 5 minutes, when the lotion gets absorbed by the skin and makes the scabs softer, you can gently start the wash. And after that, with the running water, with the low pressure, you gently rinse off the remnants of the lotion from the transplanted area to the back. You can use the comb, but only for the non-transplanted hair, just to make your hair straighter. Be very careful so the comb will not touch or will not overlap with the transplanted side. So keep a safe distance of around like 1 to 2 centimeters to start it over. You clean it up, you make your hair straighter. And after the rinsing of these areas, you apply the shampoo that comes within your set. once again. You can also grab some shampoo over your head and make it foamy with your hands, and once again you tap the transplanted area very gently. Once again, be very careful so the pre-existing hair will not be over this area or it's not stuck to this side. So tapping for the transplanted area. So you apply the same shampoo and do a wash to the pre-existing hair as well. And you can do the wash for the rest of the hair the way you used to do before the surgery. For the donor area, even though it hurts or burns, a gentle move, gentle rubbing to remove the dead tissues at the back, and also gentle massage will help with the healing, will be good. For donor area, gentle rubbing, circular motions, perfectly fine. For the transplanted area, tapping. After you applied all the shampoo, you just gently rinse it off. First 10 to 14 days after the surgery, when you have to do the wash this way, you can ask for assistance from your family members or your beloved ones so they help you with the wash. Please pay attention to the point that, especially in female patients with the longer hair, due to its structure, you have to rinse off the shampoo and lotion pretty consistently, so nothing should be left over the hair or the skin of the head. So rinse it with the water carefully. Okay, after the wash is done, one of the most common questions we get from the patients, from female patients especially, when we can start using a hair dryer. Under the normal conditions, we try to avoid hair dryer for around 6 to 8 weeks after the surgery. Why? Because the hot and humid air or hot air can damage the transplanted grafts. But because for a longer hair, especially for females, we can use the hair dryer after the wash, but it should be at least 2 fingers beyond the line. So the airstream should not be in contact with the transplanted area. So it can be only from this point and to the back of it. And after drying off it with the hair dryer, you can use the hair mask so the hair will stay smoother, or you can do the braids again. Okay, you can apply the hair mask or the pre-existing hair. It shouldn't be in touch with the transplant hair. Be very careful with this one, and it will make your hair smoother and they won't get stuck to each other. So the care will be much more easier for you as well. You can dry the non-transplanted hair, not your pre-existing hair, with the regular towel with absolutely no problem. But for the transplanted area, let it dry on air, or you can use the paper towel and gently press it so it grabs the water from there. But leaving it on itself and air drying is the best option. Once again, you can dry the non-transplant hair, pre-existing hair, with the hair dryer gently. We are not too much worried about the donor area. The most important, so the hot or warm air will not be in touch with the transplanted side. And finally, for how long you will be washing your hair this way. So the main part of the hair separate from the transplanted side. So for the first 10 to 14 days after the surgery, so roughly 2 weeks after the surgery, the hallmark for you will be the scabs. Till the scabs will fall out, it takes on average 2 weeks. Wash your hair this way. After the scabs will fall out, you can be back to washing your hair the way you used to do it before the hair transplantation surgery. Thanks for watching us. Stay tuned, and if you have any questions or any doubts in your mind, feel free to contact our patient experience team.